you ever noticed how people with different insurance plans pay different prices for the same prescription medication? Or have you ever wondered why the cost of pharmaceuticals is always going up? For example, from 2012 to 2019, AbbVie's rheumatoid arthritis drug rose from $19,000 to $60,000 a year. These high prices make it nearly impossible to afford, resulting in many patients rationing their medications to make it last longer or deciding not to take them altogether. I'm sure that many of you, just like me, thought that the high prices in medication were due to pharmaceutical companies deciding on the price. But there's more than one to blame here. Drug manufacturers, along with pharmacy benefit managers and insurers, are also to blame for these outrageous prices. The amount you pay for your medication will depend on your insurance plan, the plan's formulary or the list of drugs it prefers and covers, the size of your deductible, and the deal your insurance company has worked out with the drugs manufacturer, along with other variables that may come into play. Before I get into explaining my solution to this problem, let me just give you a quick summary of how these prices are set. So, the pharmaceutical companies develop new treatments and conduct clinical trials, but there are no regulations on how these medications should be priced. So, as a result, the pharmaceutical company bases its value by guessing how much the public is willing to pay. So, for example, let's say a medication is new to the market, shows results, is a convenient option to what might already be available. It will result in that medication having a higher price. But if the market is saturated, it will be priced at the same as its other competitors. The pharmacy benefit managers negotiate the prices in the form of rebates with the pharmaceutical companies on behalf of the insurance plans to get the medication listed and set prices. All the insurance companies do not use the same pharmacy benefit managers, which would explain why a patient going to see one doctor ends up having to pay, let's say, $50 for a medication, and another patient goes and pays $60 for that same medication. It's ridiculous. Why can't we just pay the same price for our medication? My potential solution to the high prices of medication is to change the way rebates are applied to pharmaceutical companies after they have already set the prices. By shifting the rebates to the consumer, we would have less out-of-pocket spending, and we would also be able to increase transparency in the way medication is priced, because we would be able to see the discounted price that was negotiated at the pharmacy counter. Rebate is money that is paid to the insurers and pharmacy benefit managers by the pharmaceutical companies to be able to have their medications on the market and offered in insurance plans. Rebates account for about $150 billion in discounts in the prescription drug market each year. The insurance company and pharmacy benefit managers keep all that money that pharmaceutical companies pay, money that we will never see. If Medicare adopts the plan, federal officials have estimated that consumers would save on average between $45 and $132 a month. The way that the rebates are handled now is surrounded by a lot of controversy, especially in regards on how pharmacy benefit managers have a gag clause that they wrote into pharmacy contracts that prohibits pharmacists from disclosing to patients that a drug may be less expensive if paid for directly without using their insurance. This gag clause ultimately allows the pharmacy benefit managers to profit from patients' copays. This proposal will ultimately help lower the cost of healthcare, since patients will now be able to afford their medications, resulting in less emergency care because patients will be more compliant to take their medications without having to worry about the price. The current healthcare system that we have lacks transparency and only benefits drug manufacturers, pharmacy benefit managers, and insurers. I think we can all agree that we need a change in our healthcare system for it to be more transparent and fair. Thank you.